Inviting all the speakers. My name is Catherine Hsu, and I will be moderating today's session. I am a postdoctoral research fellow at Columbia University, co-mentored by Drs. Christoph Kierlich in nephrology and Peter Sims in systems biology. I was also formerly mentored by Dr. Jonathan Barash during my PhD studies. I am also currently studying the immune defense properties of kidney and bladder epithelial cells and using single cell and cell type specific approaches and integrating that with human GWAS. So today we have a fantastic selection of panelists who will share their perspectives on developing successful mentor and mentee relationships in the research environment, as well as the necessary toolkit to leading a lab and becoming a mentor. I personally believe that mentors are have a powerful impact on their mentees' both professional career and their personal lives, and I have been extremely fortunate with my own mentors. And today's session is intended to be very interactive, so please feel free to type in your questions that you have for the panelists in the chat box. Or you can ask your questions live after all the 4 talks during our 10-minute Q&A discussion at the end. And during those 10 minutes, I will be also reading all your questions and comments you have for each of the speakers as well. And as a reminder, please mute your microphones throughout the session. And also there's a post-event survey that will be provided in the chat box at the end of the session. We would ask you to please fill it out. And if you don't have time, there will be also a follow-up email that will contain the link as well. So let's get started. First up, we have Dr. Dolores Lamb. Dr. Lamb joined Weill Cornell Medicine in 2018 as Vice Chair for Research in the Department of Urology. She's the Director of the Center for Reproductive Genomics and holds the Dow Professor of Urology. She studies male infertility, steroid hormone action, and genitourinary birth defects. She has held NIH funding since the mid-1980s and was recognized by many different organizations, including AUA, for her contributions to the fields of reproductive urology. In addition to basic science, she has extensive background in clinical diagnostics. She is a well-known mentor and trained more than 80 MD, PhD fellows, 9 of whom are now department chairs, and dozens of residents, graduate students, and undergrads. She previously directed an NIH T32 training grant, a K-12 career development program, and a NICHD Men's Health Research Career Development Grant. She is a past recipient of the Distinguished Mentor Award from the AUA and recipient of the Christina Manthos Mentoring Award from the Society of Women in Urology. So we are extremely excited and fortunate to have her speak with us today. So take it away, Dr. Lamb.
Okay, let's see. Trying to share my screen here. Okay, good. So you all can see that, right? Am I good? Okay.
Yes. Yes.
Great, thank you. All right, so anyway, I'm delighted to speak at CAIRIBU and to talk about sort of mentoring and leadership skills. And I'm thrilled to actually be talking together with Rose Khavari, who is a long-term mentee for me. And we still continue our relationship, and not only as mentor-mentee, but obviously as good friends. And I have everybody's permission to have their picture here except Rose. So hopefully it's okay with Rose as well. So, you know, it's been said that the mind is not a vessel that needs filling, but wood that needs igniting. And, you can't just sit and wait for someone to come and find you. You need to find the people who help you. And it's very important to realize that many people serve many different roles in our life, and not one person can fit every need that comes up.
Okay.
And
I mean,
so we're
I
going
don't
to
really mind.
So we're going to talk here about the taking the mentorship journey. And, you know, I have a journey image here, you know, of someone trying to go up a very steep mountain to reach the summit. And I think that this process is very applicable because, you know, we can see that there are kind of mile markers, change of direction, different types of routes and terrains. And it's not a straightforward route to get up to the top of the mountain. And so we can consider that the mentors are actually like trusted guides who have made this journey before and can help the mentee to climb up the mountain and reach the summit, which would be the top goal that they want to achieve in their career. So, you know, really the mentorship journey starts with essential questions. You know, why do we need to acquire career development skills, and how you can define your goals and steps to get there, and then really seeking out who can help you become your best. And then when to consider and start, you know, having these sort of visions of greatness for your future and how long this journey will take, and how do you take the first step for that journey. Now, when we think about embarking on the mentorship journey, it's been shown that mentorship really has very important influences on career development, but because the mentor provides career guidance, helps with career choices, job satisfaction for the mentee is increased. And in this arena, it can be measured by research productivity, publications, grant successes, and so on. But importantly, less than 20% of faculty had a mentor. And one reason may be the challenge of selecting and approaching a mentor. There's many reasons I think that enter into that. But the first thing that really needs to happen, and that the mentor can guide this process a bit, is that the mentee needs to look inward. They have to really define their own personal goals. It's very individual, and reflect on where you all want to end up in terms of your future. Obviously, you have to define an area of focus. It may be clinical, administration. In this context, we're mostly talking about research. And you have to know what you need. You have to know your strengths and weaknesses, and what you need to learn, and what you need to achieve to be able to sort of reach the summit. And you have to be able to prepare to articulate these needs and discuss them freely with the mentor. And then you have to list the opportunities of what you need to do. So perhaps it may be something like presentation, developing the grant writing skills. Again, very individual for each of us. And, you know, really the mentee has to consider their short and long-term goals, right? Again, the path that they expect to take to reach the summit. And these goals have to be feasible and realistic. The timeline has to be realistic with tangible benchmarks. And, you know, you really need to acquire the skills that you need to be able to achieve your professional goals if you don't already have them. It's also very important to expand the network of contacts that the mentor can help you with that in long-term, and know your long-term career and life goals. And so when we think about these short and long-term goals, many people use the SMART method. And so essentially for every criteria or, you know, objective to be accomplished, you need to create the path to do that. And that path has to be specific, measurable, attainable, relevant, and time-bound. And then if you break these big goals, right, reaching the summit of the mountain, into smaller mini goals, that becomes more achievable. But it's always true that the most rigorous goal, getting to that summit, may take a long time before the results are measurable. So it's very important to realize that you don't need just one mentor, you need many mentors. And so we're going to talk about what makes a good mentor, which is important for the mentors on our webinar, but also to know what a good mentor does and how to recognize one. So there's many different kinds of mentors and mentoring. There can be formal and informal mentoring, peer-to-peer, I think, is very underestimated. So, frequently we may experience challenges in our career that our peers have actually faced and overcome. And so many times our peers can actually be a huge source of information and knowledge when it comes to problem solving that we may encounter in our careers. Certainly there can be a supervisory relationship, and that individual always is usually sharing their knowledge of skills. Mentors can be role models, politically influential people, champions, and certainly clinical or research mentors. Now, in many institutions, such as Weill Cornell, we have institutional pairing of mentors and mentees. This sort of works. It helps for the local environment and kind of learning the terrain, but it is not always a long-term relationship. Other mentors may be short-term for situational or, say, a coping mentor. And then there can also be group or team mentoring, but usually there's a senior experienced advisor that's involved. Now, virtual mentoring is actually very important and I think a very powerful tool. I did this even before the pandemic. Now we do it a lot. And for virtual mentoring, many of them are, long-term mentees of mine. Rose is a huge example where, we continue our relationship. But for some of my virtual mentees, I think I have about 7 of them right now. Most of them I did not know to begin with. I had never met them and they reached out to me. And we developed a relationship, again, through the miracle of Zoom online, but it's been actually a very positive experience for all of us. And so that should be one of your considerations. There is a lot of information on the web for mentoring, both mentors and mentees. You should take advantage of this. So use resource-based mentoring information. And obviously, people can be trained to be mentors, although I would argue, I think most of it is innate in their personalities. And certainly leadership and executive mentoring are high priorities, depending on your career path. And, if you want to seek to become a chairman, a dean, to have a leadership position. So what does a good mentor do? They have to listen, they have to provide constructive criticism, and they have to teach by example. And examples of this is that they should support and facilitate the mentee and encourage them and motivate them. They also have to promote the mentee to seek independence and help them to get balance, both in their life and in their careers. And they always, always take pride in the successes of their mentees. So what are the traits of a good mentor? Obviously, the mentor is usually someone who is a master. They may be a master surgeon, clinician, a top principal investigator. Others may be less of a master, and these would be sponsors, connectors, people to put you in touch with people, but usually they're a leader in the field. And I think that really the key element is the personality of the individual. So lots of people are masters. I would say far fewer are good mentors. And again, it has to do with the personality, not just with their skill set. So the mentor should always be accessible and empathetic. They have to be very open-minded and really reflect sort of individual working styles of the mentee that could be very different than their own, respect their individuality. They also need to be a confidant and not share personal information or important anything about what goes on between the mentor and mentee relationship with anyone else. They have to be honest and consistent. And that honesty can sometimes be difficult, if there are sort of uncomfortable truths about mentee chances that need to be shared in certain situations, that advising a mentee that perhaps their path is not the best or their course of action is not the best. And obviously they should always be patient and savvy. So what kind of things can you ask from your mentor? The mentor should be prepared to offer support and assistance dealing with a problem. So you may have a very specific problem that you need advice on. The mentee many times will tell you stories about their own career where they experience similar problems, how they problem solve, and to help you to deal with the problem. And I think also try to put it in perspective in terms of the magnitude of this, the importance of the problem that the mentee faces. They always should provide feedback, give ideas and suggestions. And importantly, I think that one of the important things that they do is to help the mentee to improve their self-awareness. And knowledge of how others perceive us is incredibly important during our career development. So when we think about mentors, the most important thing, I think, is the chemistry between the mentor and the mentee. Now, obviously, they must fill the personal needs of the mentee, and sometimes that mentee may need, for example, a mentor with experience, in this case, as an underrepresented faculty, things that there are sort of common elements that may be very positive, but that's certainly not required. Communication and working styles can vary greatly, as does availability. And you have to realize that mentors come in all different sizes, shapes, colors, genders. And if you only seek people who are like you to be your mentor, then you're not going to get the best advice, right? You really want to think out of the box and maybe get out of your comfort zone and hear things that maybe are not as difficult, but will certainly help you in your career development. And remember that it takes time to build a relationship and you have to be proactive. And in fact, I think one of the most important things to know is that the most impactful relationships are usually driven by the mentee and not the mentor. And that's important to remember. For the timing, you should have mentors throughout your career. You should start early and, accumulate a whole group of mentors helping you in different areas. Some may help you specifically during your transition, such as to a new position or starting a new lab, and the goals may be different. So it may be getting presentation skills, helping you with grants or manuscripts. And the length of the relationship varies, although I would argue that I think most real mentor-mentee relationships are lifelong, but needs can change over time. And so you can think of them in terms sometimes of longitudinal versus project-based mentors. And so just for an example of that, if we have someone who's going along their career path, when they're trying to get their first promotion, perhaps they need a mentor who can provide them advice for presentation or grant skills, helping them to get promoted. And that would be project-based mentoring, or again, helping from the time of that first promotion to gain their leadership skills to become promoted, say, to a department chairman. That could be another project-based mentor, but you also are going to have these long-term mentors that will help you throughout your career. Now, again, remember that mentors can also be external. They don't have to be within your in your department or in your institution. Again, these departmental mentoring programs are good to get somebody comfortable with the lay of the land in their new institution, but it doesn't help for lots of things, such as participating in networking events where you can meet new potential mentors, leaders in the field. And one of the other important things to remember is that many times these happen in either academic or professional organizations. And so the mentee wants to really be visible, and to do that by being the presenter at a meeting, attending conferences, and volunteering to serve on committees. One more additional consideration for the mentor, and that is that direct supervisors can sometimes have perceived or potential conflicts. They could be real or perceived because, the mentor and the mentee could end up being direct competitors, right, for the same sort of funding mechanism or what have you. And that's just something to be mindful of. And some people deal with that better than others, but it's something to always keep in mind if the mentor is your direct supervisor. So my take-home messages are that the mentee needs to look inward. The mentor can help with that. The mentee should start early and plan for ongoing mentorship. work hard to find the best match and to really leverage professional connections to be able to improve your mentor-mentee relationships and to find new mentors. And I think that this can help you traverse this really sort of difficult path, but to reach the summit and realize, you know, the success of your career and achieve your career aspirations. So thank you very much. And I'm so happy that I had the opportunity to talk to you all today. Close to on time.
Yeah, no, thank you, Dr. Lamb. That was a really wonderful presentation, very unique experiences. And in the consideration of time, let's move on to Dr. Rose Khavari. She is an associate professor of urology at Houston Methodist Institute for Academic Medicine and Weill Cornell Medical College. She counts Dr. Lamb as one of her most influential mentors. Dr. Khavari has also earned her MD at the University of Texas Medical Branch and completed residency at Baylor College of Medicine. She then completed a fellowship in male and female continence, pelvic reconstructive surgery, and neurology at Houston Methodist. She is currently the program director for the urology resident program at Houston Methodist and director of research at the Center for Restorative Pelvic Medicine. Her research accomplishments are very numerous, but they include the development of a unique modification to augmentation cystoplasty for neurogenic patients and the use of fMRI imaging combined with urodynamics to study storage and voiding in patients. Since 2018, Dr. Khavari has held a K23 award from the NIDDK. This year, she received an ART03 award from the NIDDK to develop a non-invasive fMRI protocol for real-time evaluation of the brainstem during continence and micturition. So thank you. Please take it away, Dr. Khavari.
Thank you so much for inviting me. I am truly honored to be on the same panel as Dr. Lamb, as Dr. Assimos, as Dr. DeFranco. Specifically, Dr. Lamb, I know her very personally. She's been my lifelong mentor, so it is a privilege to even be on the same, again, panel. So thank you again for inviting me. So my talk is actually a little bit more practical, and hopefully I can share with you my experiences and give you some examples of what Dr. Lamb shared with us. And I'll share a little bit about my journey, and we'll go from there. Okay. All right, so as Dr. Lamb mentioned, actually every one of us probably has a lot of formal mentors and a lot of informal mentors. The formal mentors that I truly value and I think have made a big difference in my life, I will share with you their names and their photos. But I want to also bring up another point that Dr. Lamb also mentioned beautifully, is that every mentee needs to think inward and figure out what they want to do with their career, with their profession. I personally kind of think as my career having three different branches or aspects. There's my clinical growth that I want to get better at, that being running clinics, having better surgical outcomes. So there's a whole clinical aspect of the urology that I want to focus on. Then there's the education, being the residency program director, having fellows, having medical students as part of my career, and being involved with the education and the trainees, and then the aspect of research. So I think it's important for all of us to kind of think about these different goals that we have, and then try to see who can help us along the path of these goals. And these are my mentors along the way that I've had. Dr. Lamb and Dr. Tim Boone have been my K-12 grant research mentors, and also my K-23, and moving forward that almost all of my research projects that I've had. Dr. Lamb is mainly my basically PhD mentor who's helped me write grants, think critically about research. I got involved with her lab when I was a resident. And Dr. Boone also gives me the clinical perspective. And I've had other people, as you can see, that have crossed paths between clinical mentorship, research mentorship, education, and so forth. But I want to bring up a point. So every slide that I have actually has a lessons learned key point, at least for me, that I wanted to share with trainees here at CAIRIBU, is that if you notice, a lot of these mentors actually may not share the same research interest or educational or clinical interests as I do. But that's okay. Like Dr. Lam doesn't do functional urology or doesn't do neurogenic bladder, and I don't do pediatric urology, or I don't do erectile dysfunction and infertility research. But she has been such an instrumental mentor in helping me just understand and navigate the whole research platform. So it is okay if your mentor is not sharing the same exact clinical platform or research platform as what you have in mind. It's more important, as we just heard, the personality of the mentor that can help you, and the leadership skills that they have that can help you navigate through the system. So it's completely okay. Many of the people here are actually, like Dr. Miles is an oncology urologist. Dr. Peters is a pediatric urologist, and they have been my mentors. So from the education standpoint, I also want to say, think about it as education opportunities as an opportunity that you can train and mentor your juniors. And you can think about it like, for me, I broke it down to, okay, I'm going to have fellows, I'm going to have medical students, I'm going to have residents, and how can I tailor my mentorship skills, my leadership skills to each one of these trainees and help them achieve their goal, and meanwhile help me learn and become a better mentor and leader. So think about, again, every aspect of your education part that you have, education role that you have, and see who and how many people you can inspire and help throughout that career. So basically, that's the key point that I've learned throughout the years, is that many times that training education role actually is equivalent to mentorship. There are opportunities that I have used, and I'm sure there are many more available that that you guys can look into, but these are a few that I have benefited from and I thought I would share as an example. AUA has leadership program that I was fortunate enough to get recruited to this year, where they match us with in small groups with mentors, and we take a 2-day leadership class and mentorship class, and we do capstone projects. So if anyone is interested, this is done annually, and it's a very valuable experience, and it's a great exposure and networking. Society of Women Urology also has mentorship programs. For women MDs or PhDs who are interested, I would highly recommend taking a look at SUE and taking benefit and advantage of their opportunities. So NIH, although NIH is this big institute that we all kind of feel like it's so distant, I do have to say that NIDDK has been so close with me and my research over the years, and I owe it, I think, to Dr. Lam getting me introduced and involved with the people at NIDDK. Dr. Rankin has been one of the people at NIH and NIDDK who basically I've gotten to know over time, and she may not be necessarily my direct mentor, but I think she's been my to-go person and advisor, and she actually has connected me with a PhD person at UT Houston that I've become her mentor now, who's doing research in urinary tract infections, basic science research. So these organizations, although you may not see a formal platform or conference or workshop, I think they create avenues and paths for people to get connected and identify mentors and mentorship paths. So basically my learned lesson is that use any opportunity that you see that comes your way to seek any formal or informal leadership and mentorship opportunities. So I kind of think about myself as a late bloomer. I didn't really accomplish much during my residency, to be honest with you. Yes, I did do some retrospective studies, but truly research-wise, I think it was during my junior years of my faculty position when Tim and Dory took some time and invested in my growth. In 2015, I think marks the time that I I got more funding from my institution. And personally, I think it was the time that I started really producing and writing and getting more comfortable with the field of research. And that's why I kind of use that mark for myself to benchmark to look at my accomplishments. So I personally think it's been a productive 6 years, and I owe it to many people along the way. Many people who have worked in my lab have been my collaborators, students, residents, fellows, mentors. But this is the more important graph I wanted to share, is that when I look at all the grants, the big grants that I have applied for over the past 6 years, I've applied for 22 big grants, like 3 DoD grants, like multiple big grants, and they take time obviously to write, but only half of them have gotten funded. And 2 of them are under review. One of them is the R01 resubmission, and the other one is a PCORI grant that I submitted last month. So the key point is that don't give up. Just apply, resubmit, go back to your mentors, go back to your advisors, edit, revise, continue to get better, continue to try harder, and kind of keep in mind that many of these grants and efforts that you work on may not work out the way you're planning to. But at the end of the day, if you put the efforts into it, I think it will. So again, as I mentioned, I have a lot of people to thank for a lot of mentors, collaborators, and people that I've worked with. But I do want to mention, again, the key point for me is that many of the people that you train, educate, or you collaborate with, they will become your mentors, they will become your mentees. So keep these connections to the people that you invest in long and ongoing, because again, these collaborations will pay off. So thank you, that's all I have to share.
Great, thank you so much, Dr. Khavari. That was for sharing your personal experience throughout your career on mentorship and the mentors who have influenced you. So now we have Dr. Don DeFranco, who has recorded his presentation. Dr. DeFranco is a professor of pharmacology at the University of Pittsburgh and vice chair for medical education and associate dean for medical student research. He was a project leader in the University of Pittsburgh, George O'Brien Urology Center. His research areas include benign urological disorders, endocrine pharmacology and physiology, hormone pharmacology, neuropharmacology, and signal transduction. He has had consecutive NIH funding since the mid-1980s from the NIDDK and from the Institute of Child Health and Human Development, among many other institutes. He has directed or co-directed multiple NIDDK training grants. He is a past recipient of the University of Pittsburgh Office of the Provost Doctoral Mentoring Award, and his many trainees have gone on to win awards themselves, including KO1 and other funding awards. So yeah, we can start the presentation. Thanks.
Well, thank you for joining us. For joining us, we have a number of questions that have been provided us by some trainees, and the audience here is very mixed. So we have some students as well as postdocs, early junior faculty. So it's really mixed, but that's kind of what your experience has been as well. So I guess the first question is, and we hear this a lot, is how do you establish a good mentor-mentee relationship? So maybe you've got your mentor already, you know, you're the professor that you are in whose lab you're working or something. How do you make sure that that relationship is optimized?
Okay, and it really depends on the type of relationship, whether it's a PhD student who plans to be there for 4 years or a summer student, undergrad or medical student. But I think what really is common to all is that set expectations early.
Okay. At
the very beginning, set expectations. And that means a lot of things like, okay, for example, for the medical student, say I'm a medical student, I'm here for 8 weeks in the summer, it's a full-time position, what can I do in 8 weeks? How do you want me to contact you? How often should we meet? And some even personal things. Are you going to be on vacation this summer? What week? So I can plan, to maybe find other people to help me or to make sure that I'm really set up before you go away. And if it's a PhD student who's expects to be there for 3 or 4 or 5 years, expectations, like even if you don't know, like, I'm hoping to do academic, I want to be able to go to a conference every year. Is that something that you can accommodate, something you can provide resources for? How often, do you want to meet? How often do you have lab meetings? So set expectations very early. I don't think that means you have to be super aggressive about it, but I think it's important to really set that up early, and then I think then you can tell and even before you make a decision, you can tell from some of those early discussions whether or not this is a good match for you. I will tell you in my experience for 12 years managing, let's say 450 medical students a year doing research projects, that there are often pairs that just don't work. I've had students complain about a mentor horribly and write all these reports, and it's a mentor who's received mentor awards for years. Some matches are just not good. Some students want more independence. Some students want to have their hands held more. And that's the kind of thing you need to figure out is, okay, at this point in my career, do I really need someone to hold my hand, or do I want to be let go and really be free? And is that something this mentor is okay with? Hey, I want to develop my own project. I'm going to run with a project. Give me a little bit of time to do that. Or no, the mentor says, no, I got this grant. You're going to have to fit into this particular study. You can certainly really do a lot, but this is what I need you to do. And that's what you set up when you first interview someone or you first consider a mentor. You're like, what is it that they're looking for? What am I looking for? And it could be the most popular mentor, it could be the most famous mentor, but it might not be a match. And you want a good match.
So what you're saying is that it's a two-way street.
Absolutely.
And I wish I'd have known this when I was in graduate school, that you, in some ways, need to be prepared before you even establish the relationship to know what questions to ask, and to know yourself a little bit, to know how you work and how you best function.
Yes, and so I can go back to my own experiences. So as a grad student, I had a mentor who was completely hands-off and just let me just run wild. But I knew coming in, and when I spoke to other people in the lab, that that worked for many people because he had so many good people who were willing to mentor me. So many, we'll call them a sub-mentor, if you want to call them that, postdocs, other grad students. So I fell in love with that approach. As a postdoc, I had the opposite. I had someone who was very much hands-on. And I'll be honest, I struggled with that initially because I was so used to being totally free. And, and that means you take risks and sometimes you fail at stuff, but I just love that approach. And with my students, I've kind of adopted my PhD style, PhD mentor style. I tell them, hey, look, I'll give you some time to just explore. And it's more difficult for the MD, PhD students who really have a tight timeline. Yeah. So maybe I'll rein them in a little bit earlier. I'll say, okay, take 6 months, explore. This is what we do. This is some other things. And these are new people coming in. I have a new clinical fellow and a neonatologist coming in. And this is kind of what's happened. You may want to work with that person and see what they're doing. But take some time to explore. And then let me know what you want to do. As a backup, here's the grant. This is what you can do. But I give you a little bit of freedom. And I really like that. And I think for me, it's really worked out for the mentees that I've had, that they've all kind of found what they wanted to do, even if it's been after 2 years of exploring, where I finally had to rein them in and say, okay, we're done exploring. Let's do this now. I mean, you really want to finish. You've learned a lot from your exploration, but we really need to think about, you need a paper, you want to move on in your career. It's okay to say, I learned a lot, but you need some kind of credibility. You need some creds. And so publications, writing grants, whatever. So for me, that's works. And for other people, they want to know what they're going to do walking in and what they're going to get out walking out. So you just have to find a match. That's kind of what I think is key.
So how do you know if you're in a relationship with a mentor? Let's say you're in an established laboratory and you've got your graduate student, you're working on a PhD. How do you know when it's time maybe to engage other mentors or sub-mentors, as you said? I can see where sometimes it might not be the match that you're saying is optimal. How do you know when you should kind of rescue that without disrupting your timeline too much?
Yeah. So, I mean, sometimes the relationships get sour. I mean, people get married and they get divorced, right? I mean, the wedding day, you don't ask someone if they plan to get divorced on the wedding day, right? So sometimes things go sour, and I've seen that too at many different levels. And I think for me, when it happened to some of my mentees who just really weren't fulfilling expectations or really lost interest in the project, the goal is, okay, what can we salvage from this? Okay. And ideally, as a, say, or any student in a research lab, let's try to get a publication. Maybe it's just a mini review. Maybe it's a short little report, but it's not going to work. We're not going to go really far, but let's at least try to get something that you can look back when all is said and done and say, I got some value out of this.
That's great.
And that's the way to get out of it, to say, and I tell students who switch their research labs either as PhDs or as MDs, say, when you disengage with your mentor, you should say, hey, you know what? I want to try to finish this project as best I can, but I think it's in my best interest to go to this other lab or this other mentor. What can I do either just before I leave or even if I'm not here, but just try to remain engaged to kind of, so you're giving back. I'm going to try to give you back what you've given me, although I really don't feel this is the best, long-term place for me to be.
That's a very good suggestion. And it's also one that, you don't want to burn any bridges. And, even you should be thinking about that, even if you're a student, about your future and about not burning bridges and maintaining good relationships where possible. So I like that suggestion.
Yeah. And don't expect that everyone's going to be also thrilled that you're leaving your lab, and that's okay, but at least if you provide some, this is what I'm going to try to do to make it, less, whatever, stressful, or give you something back. Maybe over time that mentor will say, okay, yeah, this student helped finish up this mini review or helped fine. I'm not really happy they left, but okay, at least they were thoughtful and they were honest about things and able to give me something back. So that's always worked for the students that I've seen, and even recently who've switched. And we get quite a few, maybe 10% of that 150 per class that switch. And they always come like, what do I do? I don't know what to say. I just be honest and say, let me finish what I can. But I really feel it's in my best interest to do something different.
Great idea. One question we get a lot from trainees is sometimes they feel they don't get enough training to be mentors themselves. They don't get during their graduate school work or postdocs or whatever, that it's all about the work and the science, which it should be, but that they then don't feel prepared to become mentors, to start their own laboratories, to set up their own sort of teams. It's not part of the curriculum. How would you say people should approach that in their training?
Yeah, I think what I ask my mentees is, and we're lucky at Pittsburgh, there are quite a few undergrads who are interested in research, probably here too. I encourage them to take on an undergrad or two. If they're early on, I say just take on one, and I make sure I work with them. Okay, let's not overwhelm them. Let's not give them too much. Okay. Let's find out how they're starting off, and have they had lab experience. Even if some of my best undergrads came in with zero experience, some of my best clinical fellows who published and ended up doing great work came in with zero wet lab experience. So I say, look, it doesn't matter if they don't have experience. And that's a good training thing for you, to take someone with no experience and then see what it takes to train them. So I encourage the trainees to be mentors, and but give them some guidance to say, you always have to have level appropriate projects, bite-sized projects. And if someone is ambitious and they do more, great, you keep adding. But I encourage them to do that. The other thing is there are, at least for junior faculty at nearly all schools now, there are mentoring committees.
Okay.
We have one. Every new junior faculty has to have a mentoring committee. The fellows, they all have to have a mentoring committee. And what I think is important when you do that is to make sure you take charge of that. Because I can tell you that many times when those things don't work, it's because the mentee is not really, I won't say aggressive, but proactive.
They're not participating.
They're not participating because most of the senior mentors, and I'm on a number of these committees, if someone doesn't contact me, I'm not going to go out of my way to kind of track them down. Not that it's not an arrogance. It's just that I have a lot of other things going on, and I really want that person to learn to have the initiative to say, hey, we need to have these meetings every 6 months. I don't have a lot of new data. It's okay. Let's talk about what you plan to do. What were the challenges? That's the part of that. These mentoring committees, and I can guarantee you they fail when the mentees aren't proactive, and I think that's the biggest recommendation is if as a new faculty or fellow, engage in these mentee committees, whatever you call them, and make sure mentoring committees, and make sure that you are proactive. The people that are volunteer or agree to do it because they want to help you. But everyone is so stretched that if they have to track you down, then that's not going to be an effective relationship. you know.
So that's a theme that kind of ran through the whole thing, is that you got to be participatory. It's a two-way street.
Mhm.
It's not just about being a passive mentee, but about being two-way. In summary, would you say, could you maybe just sort of review some of the tips that you have, maybe identify some of the mistakes that you've seen, some do's and don'ts, if you will?
Yeah, well, certainly for the don'ts, don't hide. I mean, it's so easy to hide, and that's what we struggle with, not only people in my own lab, but with medical student research projects. It's so easy to hide, keep busy doing other stuff. Maintain some regular, engagement with your mentor, your secondary mentor, your primary mentor. Maybe your primary mentor, who is some famous professor, only wants to meet you once every 2 months or what. Fine, but maintain that. Find a way to maintain that. Maybe your secondary mentor wants to talk with you every day, and maybe just 5 minutes. If that's what works, then that's what you do. So maintain engagement and set up what that means. It's not going to be the same for everybody. It's not going to be the same for you. So for the clinical fellows who often have a lot of clinical responsibilities, we meet less frequently, but I try to make it regular. My junior faculty member who is in pediatrics is really busy, but she said, look, I need a weekly meeting with you, Zoom, and we'll be soon, I hope.
So you do virtual, so a combination?
Combination. And she said, even if I don't have anything, I just want to check in, let you know how my clinical work is doing, and then you may have an idea about, managing some of the clinical residents that I have to manage. So whatever it takes, just set it up. If she wanted once a month, I would do once a month.
All right. That was a really engaging discussion and great advice from Dr. DeFranco. And I'm sure he is, feel free to email him if you have any follow-up questions. But now in the interest of time, we'll have Dr. Dean Assimos present. And we have Dr. Assimos, you have about 10 minutes, but for the rest of the audience, if you can stick around for about 5 minutes afterwards to kind of have a lively discussion, that would be wonderful. If not, we totally understand your time commitments. All right, Dr. Dean Assimos, I'll just give a really quick introduction, and you'll be on afterwards. Dr. Assimos is an endowed professor and inaugural chair of the Department of Urology at the University of Alabama at Birmingham School of Medicine. He is co-director of the Office of Patient Experience. He's an expert in kidney stone disease and PI on CAIRIBU P20 Exploratory Center, and which is now in its second year, 2-year grant cycle. He has mentored many urology residents, medical students, as well as 4 PhD researchers in his department, all whom currently have NIDDK funding to study kidney stone disease. He has also mentored many urology fellows, and he received, in 2013, he received the Ralph Clayman Mentoring Award from the Indo-Urological Society. All right, take it away, Dr. Assimos.
Well, thank you very much. I really wasn't asked to put a formal presentation together, but just make comments. And I've certainly enjoyed everyone's discussions already. And I'd like to just provide my perspective on mentoring. I think one of the important things to recognize is that it is a two-way street, the mentor and the mentee. But really a lot of the heavy lifting is on the mentee side to make sure that they continue to be engaged with their mentors. I think as a mentor, we need to lead by example. I had some great mentors during my training. Dr. Jack Grayhack, who was a giant urology during my residency, and Dr. Bill Boyce during my fellowship years. Tremendous mentors. I think as a mentor, one of the things you need to do is to sit down with your mentees and help them, to define their goals. Now, when a mentee comes to me and say, well, what do you think I should do? I said, you need to tell me what you want to do. And you need to provide sort of the framework for short and long-term goals. And I certainly will help you with that. But I want to make sure that the mentee is passionate about what they're doing. Because if they're not passionate, I don't think they're going to be successful. So they have to show that they're engaged. And if they're not engaged, we might have to kind of reconsider what the goals should be. As a mentor, you need to help the mentee gain their skill sets. There's numerous ways of doing this, various different skill sets. For example, there could be analytical techniques. You could set up the mentee with people that could help them in that, or you could provide some of that with them. Statistical techniques at UAB, we have certain courses and programs I can direct the mentees to. And with regards to leadership skills, you could certainly, by leading by example, that is one way. But at UAB, we actually have formal leadership programs for basic for clinicians as well as physician scientists as well as basic scientists. And as a chair, anytime I see one of these opportunities, I will get faculty or my mentees involved in such programs, and they find those to be most valuable. So, most, I think, institutions have these programs, and I think it's very important that the mentors can align the mentees with these sorts of programs. The mentoring relationship can vary, as previously mentioned. I have some mentees that I meet with on a regular scheduled basis, every month. I have some that I'm meeting with a couple times a week, and I have some that I'm not meeting with as frequently. So I think you just have to again, define what the relationship is. And I think designing that so you can look and see if your mentee is progressing and need to, as a mentor, sit down and say, yes, you are progressing. Maybe you're not progressing where you should be. And then try and give them the energy or the direction and how to achieve their goals. So I also believe that, mentees should seek out multiple mentors. They don't always need to be housed in the same department or necessarily at UAB. We have an undergraduate graduate campus and a medical school campus, and we have some of our mentees that are working with people on the other side of campus. So it just depends on the needs of the mentee. I think it's important as the mentees go through this developmental process that they're making steps towards autonomy. You want them to become independent investigators as they move forward, and just assessing for that and helping them self-reflect. Obviously during the pandemic, we've been using virtual platforms for mentoring, and I think we'll continue to use those because in some instances they're more convenient. We can do a good job, and in other instances you have to sitting down and having a cup of coffee. With regards to managing a big research group, one of the things that we've done within our department and within our research group, everyone undergoes what we call a DISC profile, and that gives you an analysis of how everyone interacts to various things, and then we present that, and then that gives us a better understanding on how people communicate. So we found that to be a very useful tool here at UAB. So it is a road. As a mentor, sometimes it's a career-long relationship, and sometimes it gets stopped. I've had some students that were very, very productive, and they found another passion. And they came to me, they were kind of embarrassed because, well, they were going to decide to pursue a career in plastic surgery. And I said, look, you've done a great job. I'm happy for you. You found your passion. So I think that's the most important thing, that as a mentor, you can help the mentee achieve their sweet spots in their career pursuits. So thank you very much for allowing me to kind of reflect on this subject.
Thank you, Dr. Assimos. That was really excellent and very unique to share your perspectives. So now, thank you to all of our wonderful speakers, each with your own unique perspectives in your experiences on mentorship, and all very inspiring. If anyone has any questions, please feel free to now unmute yourself and ask your question. Otherwise, I'll be reading from the chat box, or if anyone else has any other comments. All right, so I'll start with some questions from the chat. So one from Christina Peniston. This is for Dr. Lamb. Do you think an early career investigator should actually create a schedule for mentors throughout their career cycle? In other words, solicit new mentors as one progresses through career stages?
So I think they certainly should do that, but I think they also need the longitudinal ones as well. And, you know, I'm old enough that I can tell you that I never even realized I was a mentor, and we never talked about mentors and mentees, you know, when I was an early career investigator. And yet, you know, I formed relationships and friendships with people who then, you know, were incredibly impactful to me in my career. So I think that you can work and try and pick, but the best relationships are going to be the best mentoring situations, I think. And that's why I say I think that the chemistry is most important. And like Rose, a lot of these people are in fields totally different than mine, you know, and that's okay, because the advice they give me is really wonderful and very helpful. So, you know, it's, I would say though, that like the politically important people and the champions are absolutely key to these things. And, you know, because they're the ones that are going to be nominating you to, you know, get onto committees, nominating you for awards, and that helps your career immensely. So, but I still think it's the chemistry and the relationship that drives it. But yes, people should look, you know, often for mentors and mentees.
Great, thank you, Dr. Lamb.
Thank you.
We have another question. We have a question for Dr. Khavari. Do you advise assembling a group of mentors, each with specific skills? For example, one with grant writing expertise and others with other types of expertise?
I think, so I think earlier on, again, like in my career, there wasn't so much discussion of like structured mentorships and like assigning people as your mentors. I think as Dr. Assimos and Dr. Lamb mentioned, a lot of these came over time as we got to know each other and we got to know what the mentor or your friend at the time, your advisor at the time is interested or is an expert in. And then that person just automatically sort of becomes, your emails or communication becomes focused on the grant writing, or the other person, it gets steered toward, let's say, clinicals. So I have personally been involved in a lot of these formal situations that they team you up with a group of people, you're their mentor or you're their mentee, however that is, during residency or fellowship. These things, I don't think the structured assigned mentorship groups or assignments don't really work or last, or they're not as productive. I think the ones that you establish out of interest, the mentor is interested, the mentee is super interested and engaged, those are the more long-lasting kind of relationships and more high yield. So you learn about the mentor's experience and expertise and interest as you get to know them more, and then they just become that part of your career, advisor or mentor. But I think mostly just allow time for the two people to get to know each other and understand it. Because the mentor also have to invest. I mean, they're very busy people. They have to invest their time to teach you and train you and be involved with you. So they have to see that they do want to get invested. So it's not just a little click of a button, you're my mentor or I'm your mentor.
Great, thank you. That makes sense, Dr. Khavari. And we also have a question for Dr. Assimos. A great idea to profile team members so everyone knows how to interact with each other. Are there specific profiling tools you would recommend?
There's this thing called a DISC assessment. So that you can have that, people do it. I think it takes about 30 minutes or so to do it, and then you get an analysis, and then you get together. There's these different styles, and you get in a room, and you have certain people that are really kind of dogmatic and driven, and more people that are interactive and contemplative, and so you learn about each other. And so that's a tool that we use quite frequently at UAB. We administer that to potential faculty recruits and for leadership positions. So yeah, that's a great tool.
That would be wonderful to share, Dr. Assimos. Yeah, I've never heard of this, and
DISC
I would
assessment,
like
yeah.
to DISC assessment. Okay,
Yes.
I think maybe we could share with the CAIRIBU committee or
Yeah.
the community. Yes.
There's some cost to it, but you can see whether they have it within your institution.
Oh, interesting. Okay, I think that sounds like a wonderful idea, regardless, or something similar to that. Let me see. I have another question from Jim. For the group, I'm curious if you have found effective ways of letting mentees or mentors provide feedback to you, anything formal or things that facilitate feedback.
I can go first and just have one comment. Allow time. Give your mentors time when you ask for feedback. Being on a grant, being on a manuscript, being on a topic, you can't just expect them to be available the next day to meet with you. So I think just giving them time is very important.
Yeah, no, that completely makes sense. And I think, it takes time to get to know another person too. So every relationship is unique in that aspect. So if we don't have any other questions, thank you all for such a wonderful discussion and, wonderful presentations. And, I think we're all very inspired by all of your talks, and we hope that we can create our great successful relationships of our own mentee-mentor relationships. Thank you very much, everyone. And a reminder that there will be a survey that I think it's provided in the chat box for you to fill out. Otherwise, it will be in an email. And also, as a reminder, these forums are every first Wednesdays of the month. So the next one will be in the first Wednesday of October at 1 p.m. Eastern or 12 p.m. Central Time. Thank you all, and have a great rest of the day.
Thank you.
Bye.